So I'm really excited about some of the cutting edge treatments at the O'Neal Comprehensive Cancer Center. My name is Dr. Erica Stringer-Reasor. I am the director of the breast cancer program at the UAB O'Neal Cancer Center. Breast cancer is a disease of cells that continue to grow out of control. Normally, your body knows to make cells when you need them and to stop making cells when you don't need them. In breast cancer diagnosis, these cells continue to grow out of control and can form lumps or bumps and masses called tumors. So if there is a discoloration or a change in color, if you feel a lump or bump or a rash that just doesn't go away, those people should inform their doctors and get evaluated. Most people detect cancer, specifically breast cancer, on a screening mammogram. That's over about 70% of cases. A mammogram is simply just a series of x-rays. And from there, we can detect small lumps or bumps or even calcifications, which can be an early sign of breast cancer. We know that in the United States, the median age of breast cancer diagnosis is about the age of 62, but certainly breast cancer can be diagnosed at any age. We also know that screening mammograms are available for average risk patients at the age of 40. So there are some particular markers in which we help diagnose breast cancer, particularly the hormones of estrogen and progesterone. If the tumor is estrogen positive, we have good targeted therapy to risk reduce the chance of cancers coming back in those cases. So there are many different types of treatments for breast cancer, and it's certainly not a one-size-fits-all approach. We have multiple different types of surgeries available for patients, and for many patients, it may be a choice of what they want. And other cancers grow quite fast and need a more aggressive approach with some therapies such as IV therapy in the form of chemotherapy and a whole bunch of different radiation techniques now that can be very safe and tolerable. So the one takeaway I would say that I would want my patients or the members of the community to know about breast cancer is that it can affect anyone, no matter the age, the gender, the race or ethnicity. I also say that breast cancer care is very individualized, and we know that all breast cancers are simply not the same. Some grow faster, some grow slower, and they will really need an individualized, comprehensive approach to treat those cancers. I think there could be many benefits in participating in a clinical trial, not only for the patient, but also for patients that come many years later. We all know that medications that we see now over the counter began in a clinical trial, and we know that many patients gain a lot of benefits from clinical trials. There are ways to participate in survey studies to monitor your symptoms. There are imaging studies. We also know that there are exercise trials and nutrition studies. So there are so many different benefits for participating in clinical trials. The way to advance the field forward, to bring new drug therapies and discoveries forward, and the potential benefit of the patient getting great outcomes from the therapy. So I think that there are many reasons why, if the patient has time and the support, that there could be a benefit in participating in a trial.